Welcome back. We're in the last video for the lymph and immune system. This time, we're talking about acquired immunity and then some reactions that people have, which is when the immune system goes a little overboard. Okay, so let's get started talking about the primary immune response. In the primary immune response, what we can see is what happens the first time you're exposed to an antigen. So you're exposed to an antigen right here where the arrow is. And as you can see, the first 5 days after you're exposed to an antigen, say it's a bacteria, the numbers are growing, okay? And yet, you're doing your non-specific immunity, and then as that's failing because the numbers are growing, then your specific immunity is going to kick in, but it takes time, okay? And so what we can see is it is going to take about 7 to 10 days before we're going to start seeing significant amounts of antibody being produced. And as I mentioned before, the first antibody that is produced is that pentamer, IgM. And so that peaks at around 10 days. And as you can see, it's completely gone about 2 weeks after the infection started. So starts late, comes up, peaks quickly, and goes away quickly. But while it is peaking, we are starting to see levels of IgG so that your total antibody level by about a week or 10 days is higher than just your IgM level, because your IgG level doesn't peak until about 2 weeks, almost 3 weeks after the infection. And then it will start declining and it'll be mostly gone about a month after the infection. Okay, so that's what happens the first time you're exposed to the antigen. Now remember, you were making memory cells at your first exposure. So the second time you're exposed to it, those memory cells are going, oh, I've seen this before. So look what happens to IgM. It's peaking maybe, 10 days, and then it goes back down. But look, IgG peaks earlier. And whereas the primary response, we only got, maybe 1.25 amount of IgG as we did to IgM. On the second response, we are getting about 3 times at least IgG that we did of IgM. So the total amount of antibody on a second immune response is much greater, okay? So this is why having your primary response with the immunization is much more important, so that if you're ever exposed to the real organisms like measles or mumps, you are having a secondary response, not a primary response, okay? And also notice in this time period right here, this is the time period where the organism counts in your body are going higher, higher, and you can feel like, I feel like I'm getting sick. I feel like I'm getting sick. But then what you realize 5 to 7 days, 10 days later is like, I never really got sick. It's because your immune system took over. But there's one more thing I want you to notice. IgM went totally away after 2 weeks, okay? But IgG stuck around, and it can stick around for months, and for some antigens can stick around for years. So say, for instance, your primary care physician thought that you got hepatitis from being exposed to somebody at a restaurant, and they wanted to know, was this an acute case of hepatitis from that? If they did blood tests for hepatitis and it was IgM that was positive, then you would know, yes, that was a recent exposure in the last 2 weeks. But if it's IgG levels that are up, you don't know if it was 2 weeks ago, if it was 2 months ago, if it was 6 months ago. or if it was a year ago that you were exposed to it. You have no idea. So that's how this is really useful clinically. All right. So what you need to get out of this, antibody levels rise much higher in a secondary response than in the primary response. So this boosts your antibody levels to help prevent disease symptoms so you don't get as sick. And IgG stays around for a much more prolonged period of time. All right, so let's talk about acquired immunity. When you're getting immunity from being exposed to antigens or antibodies, we have two different types of acquired immunity. Active acquired immunity is where you are making your own antibodies, whereas a passive acquired immunity is where you're being given the antibodies. So the most common type of getting immunity is where you're making your own antibodies because you got sick. You were infected with the pathogen. You came down with the flu. You came down with whatever disease it was, so you made your own antibodies. Lots of times we try to prevent this disease by having immunizations. The vaccines contain an antigen. Okay. They're taking a little piece of the protein, a little piece of the virus. Could be a piece of the messenger RNA from it. It could be a little piece of the capsid. It could be a little piece of whatever it is, a piece of the plasma membrane, something acts as an antigen that is put in the vaccine, so you will react to it. And so you're going to have a primary response to the immunization. So when people say, I got sick to the shot, so you must have given me whatever the disease was. Oh, no. If you got sick with the shot, realize the amount of antigen you got from the shot was like less than 1,000th of the amount of antigen you would get if you got sick. So you would have been a million times sicker having gotten whatever the disease was. Okay. And the bonus is with the immunization, you have memory cells. Okay. So passive, where you're given antibodies, I've alluded to this already. IgG crosses the placenta if you are a pregnant mother. And if you are a nursing mother, IgA in your breast milk can protect your baby for those months that you are breastfeeding. Another example is when we give immune globulin to people who are exposed, like after snake bites, because there's antigens in that, or gamma globulin given to some hemorrhagic fevers in Africa, or some types of hepatitis, and can be protective depending on the disease, could be protective for a week or for 3 months. All right. Seasonal allergies, and I use that word seasonal loosely because in most parts of the world, in most parts of the country, they have seasons where if you have a freeze, you're killing everything. And so people don't have allergies from being outside. The only allergies you would have would be from being inside, where you would have dust allergies and cockroaches. Dead cockroaches and their droppings are very allergenic. So let's talk about seasonal allergies. Here in California, our allergic season only goes from January 1st to December 31st every year. So that's because we have stuff flowering all year round. And I got to tell you, orange blossoms, very allergenic. Avocado blossoms, very allergenic. And we have all different kinds of citrus, all different kinds of avocados. So we got them blooming about 10 and a half months of the year. So let me give you an example that most of the country deals with, and that is something called hay fever. We don't have so much here in California, or ragweed pollen. So that the antigen for allergies, we just call them allergens instead of antigens, but it's antigens. So here's an example of an allergen from ragweed pollen. It's binding to the receptor on a B cell. It's going to activate the B cell. So what's going to happen to the B cell? Well, you already know the answer. It's going to become a plasma cell. So it's going to become an antibody factory. And in this case, because it's an allergy, the immunoglobulin that it produces is IgE. Did you remember that? I've mentioned that already. Okay. So it's producing IgE. And do you remember what kind of cell IgE binds to? It's going to, okay. And here, before I get to that, folks with allergies make IgE and folks without allergies make IgE. But the folks with allergies make 10 times more IgE than those without allergies. So, yes. If you're the type of person that has allergies, you are going to be more allergic to more things than people who don't have allergies. So, yes, you can become much more allergic as you age. It's not fair and it's not fun. Okay, so the IgE is going to bind to mast cells. You remember what mast cells are. What do we call those cells when they were in the blood? And more importantly, what's in these little granules? Not going to tell you this time. Okay. Because here's what's going to happen. The next time this little allergen comes around, that allergen is going to bind to its receptor on that antibody, and that granule is going to release its contents. You need to know what that is, because the results of releasing that chemical, that's what's going to cause the symptoms of the sneezing, of the running eyes, of the itchiness, all of that stuff that you may go to your local pharmacy and buy a whole class of drugs. Things like, oh, I don't want to give you names. Okay. Anyway, figure that out. All right. Another example, autoimmune disease. We've mentioned autoimmune diseases already in this course. So in autoimmune diseases, antibodies or cytotoxic T cells with the perforin and the granzymes are going to attack the body's own cells. So in this case, I have an example of antibodies. Okay, and it's normal for antibodies to be on bacteria, but here we have antibodies attaching the body's tissue. And in fact, this is a picture of thyroid with the colloid in the middle. And here's antibodies attaching the follicular cells. And the exact causes of autoimmune disease is kind of unknown, but we know there's a lot of genetic and environmental factors. In other words, there's a whole lot of different things, and there's no one cause. And autoimmune diseases involve a lot of different organ systems. And what I want you to know is, looking at this picture, they are much more common in women than men. And let me show you a couple of interesting ones. Graves' disease, Hashimoto's thyroiditis, don't have to know those names, but both of those are diseases that affect the thyroid gland. Very interesting. One of them makes your thyroid gland hyperactive. The other one makes your thyroid gland hypoactive. Rheumatoid arthritis, we talked about that one when we were talking about your joints. Vitiligo is the disease where it attacks your melanocytes on your skin. So you have areas of depigmentation of your skin. So if you've ever seen pictures of people, that's why Michael Jackson started wearing the one glove on his hand, because he had vitiligo on his hand. And there's a lot of famous models now who have vitiligo on their skin. Type 1 diabetes is now recognized to be an autoimmune disease where it's attacking the beta cells in the islets of Langerhans in the pancreas. There's a type of anemia that's related to that. Multiple sclerosis, when we talked about that, here it's an autoimmune disease attacking the cells that make the myelin sheath inside the central nervous system. So those are the oligodendrocytes. And then we have autoimmune diseases that attack in the kidney, as well as other tissues in the body. And the last topic I want to talk about is peanut allergies and exposure to some other allergens because they're a hot topic here in the United States for about the last 10 years or so. So much so where you can't send your child to school with peanut butter and jelly sandwiches, which used to be the norm for about 80% of children in the United States. And in fact, if we look at peanut allergy prevalence in the United States over a 10-year period at the beginning of this century, the incidence of children being allergic to peanuts went up almost fourfold. So the American Academy of Pediatrics said, stop feeding your children anything with peanuts into it. And what happened was it just skyrocketed. And so now they have taken that all back and said, oh, my bad. And now they're telling parents, make sure you introduce peanuts to your children by the time they are a year old. And I'll be explaining why shortly. So we looked at, they came and looked at other stuff before they came to those reasoning. One thing they looked at is like, who is more likely to have a peanut allergy? What are the risks? And what they found out is one thing it's related to is the income. The more money you had, the more likely you were to have a peanut allergy. So, was it because if you had money, you had people cleaning your house, you had no dust, you had nothing, they were sterilizing everything, and they were like making sure, like, what was it? Or was it because you were poor, you weren't really paying attention, and so you didn't really know what was happening with your kids? Well, okay, it wasn't that. So, what they looked at, and it wasn't just here in the United States, it didn't have to do with just being poor in the United States, it had to do with worldwide. And so it was had to do with high income countries. So what they found out looking at low income versus high income countries is in the low income countries, the number of organisms kids were exposed to was about this much compared to in the high income countries, the number of organisms kids were exposed to was this much. So the problem is if you're not exposed to them, what was happening when you were finally exposed to something that was new and different? And so they looked, there was a great review done by people looking at hay fever and asthma. And what they found out was kids who lived on farms and kids who were exposed to cow's milk as opposed to other forms of non-animal milk. So it could be cow's milk, could be goat's milk, could be sheep's milk, but it was an animal-based milk. So in other words, they were exposed to microbes. Okay, those kids exposed to microbes. And they looked at their response to microbe exposure compared to kids who did not have the microbe exposure. And they compared what their response was when they entered school. Okay. So they took these kids with all these exposures versus kids who didn't have these exposures. Okay. And they looked at them when they entered school. And the kids who had exposures to all these microbes, when they were exposed to something new, their helper T cells said, so what? We can handle it. And their suppressor T cells said, all right, let's stop the reaction. We don't need to go wild. Whereas the higher income kids, their suppressor T cells went wild and said, oh my God, I've never seen this before. Whoa, 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 whoa. And the helper T cells started cytokine, 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 cytokine. And you just had this robust reaction to it, attacking it. Okay. So the bottom line was we need to have kids to have high exposure to microbes in their environment when they are little. Okay. So that we have a diverse exposure. So their gut has all these germs in it. Let them play in the dirt. Let them suck on their fingers in the dirt. Let the cookie fall on the ground. Let them eat the cookie on the ground. So they get a balanced immune response when they are young, because this will protect them against allergic disease. Do not go around bleaching all the surfaces in your house. No, 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 no. Don't pull out the Purell every time you put your child in the little grocery cart. Let kids play outside. In other words, let them eat dirt and live longer. And with that, thank you so much, because we are done with the lymphatic and immune system, and I'll see you for another immune system. Have a great day, and thanks again for all your hard work.